Hi, Morgan.
Hi.
It's good to see you again.
It's good to see you again too.
Okay, so last time we saw each other, you came in with a chief complaint of right-sided neck pain that radiated into your right eye.
Mm-hmm.
We talked about your history. We took some X-rays. I did some exams on you, and then I took all that information and I analyzed it, and I came up with a care plan that is going to be specific for your needs.
Okay.
And I'd like to go over some findings that I found.
Okay, sounds great.
So, just like reviewing your history, back in 2011, you had a concussion, and so that was a pretty traumatic event.
Yeah.
Yeah. And so what I think happened from your concussion is that for your body to adapt to that big of a force blown to your head, your spinous processes, like one of them in particularly your C2, which is this top bone in your neck here, which I'll show you in a second, subluxated. And that just means that it went out of alignment from the other bones, and when the vertebra go out of alignment, and that can be from trauma, like what happened to you, or even thoughts and toxins can cause this to happen. That misalignment can cause interference through your nervous system. And if you didn't know this, your brain is the chief controller of all your bodily functions. So that includes your respiratory rate, your digestion, your hormone secretion, your growth, your recovery. Like, it does it all. It, picks up the senses from the environment, and then the nerves bring that information back up through your spinal cord and back to your brain. So when there's any kind of, let me bring this out. When there's any kind of misalignment, here's your C2, by the way, when there's any kind of misalignment that can put some extra stress and cause inflammation on these nerves here, which can interrupt that communication from your brain to your body, which won't allow you to heal as well. It could cause pain. Pain's usually the last symptom, the last thing that you'll feel. So after the problem's been there for a while, then you'll start to feel the pain. But as a chiropractor, our job is to detect and find these subluxations and to clear them with a high speed, low intensity force. And then your body will be able to heal better from the inside out. So just having that communication, your brain and your body will take care of the rest.
Cool.
Yeah, it's pretty cool. Okay, so, and then I also know that you're a student and that you sit a lot, right?
Yeah.
Okay, so also sitting down in this more like flexed position is going to put a lot of strain on the muscles in your neck back here, which could also cause subluxation to occur and muscle imbalances just from having these muscles stretched all the time and these ones kind of flexed, and putting weight or stress on different parts of your spine that shouldn't necessarily be there. So now we're going to look at your x-rays, and this is a normal x-ray and this is your x-ray. So just off the bat, what's one thing that you can notice is different?
That one is curved and mine is almost completely straight.
Yeah. So that's exactly right. So this is an ideal shape to the spine, because that's like a nice and healthy, like biomechanically, like your body's able to support the weight of your head. And then when your head is more flexed forward, which yours is just slightly, that puts a little bit more strain on the posterior neck musculature, just because they're having to work extra hard with stabilizing your head. Just like if you were to like hold something heavy like way out away from you, you're going to be using way more muscle opposed to like if you were just to like stack it right on top. So that's kind of what's happening like with your with your spine. So your muscles are really having to work hard. And those hypertonic muscles, which also we found on some of your exam findings, some of your suboccipital muscles that are here were really tight. And that could be contributing to your headaches, since they kind of radiate up into your eye. You have a nerve that comes out of that group of muscles. So that extra like tightness around the nerve can really like irritate the nerve and cause pain to spread where that nerve goes.
Okay.
So by adjusting your C2 spinous, which I have an image of right here, this is the open mouth view that we took. This little triangular shape, which is a little bit hard to see, is your C2 spinous right there. And this line is midline. So as you can see, the spinous is to the right of the line. But we really want it to be center, because having that twisted like that can put extra torque and strain on your spinal cord, which goes right down in between the canal in your vertebral column. So also, like when we did the exam, we did compression, flexion compression. You experienced some pain right there too, right?
Yeah.
And then also on palpation, that segment was a little tender. So the plan is, we're gonna adjust that segment, and I'm gonna analyze your body for any other additional spinal misalignments and subluxation, so we can restore the proper flow and function of your nervous system, so then you can heal better, start to feel better, and like overall just like have a resilient and just fully functioning nervous system. So some other things that we found were some trigger points on your rhomboids and traps, which I know you work out really hard several times a week, which is awesome. So I hope you keep that up. And I programmed you a few other additional neck exercises that I'd like you to do to strengthen up the front part of your neck musculature, and some stretching.
Okay.
So I got all this printed out for you so you can take home, and if you have any questions, we'll go over that. Yeah. And a lot of that is like really mobilizing those muscles to get all those trigger points out and just have like a balanced like musculature, so we can help like keep your spine in a nice like stable like correct position. And doing these exercises along with getting adjustments is really important to maintain and follow the care program that I'm going to explain to you in a minute, just so strengthening those muscles and getting those like hypertonic muscles taken care of will allow your adjustments to sit better. So if you have like really tight muscles on like one side of your body and not on the other, they're going to be putting a little bit of extra stress, like pulling your vertebra like one way, so you'll like subluxate more easily. So by doing that, we're just going to speed up the recovery process and the healing process to like get you feeling better as soon as possible. So I would like to see you 2 times a week for the next 8 weeks.
Okay.
And on the 8th week, we'll have a reeval, and we'll go through all this like same exams, and we'll do some of the same forms just to check back in and like see where your pain level's at, see if we've improved anything, see if any of your range of motion is better, and if that pain is still there, and like what the rating of it is now. Because I would really like, the goals for the care plan is to get your 6 out of 10 cervical and headache pain down to a 3 out of 10. That's what I would really like to see from you. And also on one of your on one of those purple forms that I gave you about your headache pain, I'd like to see that decrease down to a more mild pain level than having it be more of like a moderate pain level. So that's just some of my goals for our work together. And also, like, looking back over some of your history in the forms that you filled out, like, you have a really good diet, which is awesome. You drink plenty of water, so keep that up. And I think that it would benefit you to try to increase your sleep a little bit. You do pretty well compared to a lot of people in graduate school. I'm sure you get like 6 to 7 hours, but if you could even get that extra hour, it'll just help your body heal and recover and have you wake up feeling fresh, and so that would help. Also, if your neck pain gets to be really bad and it's starting to make you have a headache, like a 6 out of 10 level, I recommend getting like a heat pack and putting it around the top of your muscles here, like on the very top of your neck, because those muscles are very tight, and the heat will help them like relax and hopefully release some of that like tension on the nerve that goes through those suboccipital muscles, and hopefully bring your pain back down. Okay. So does everything sound okay so far? Do you have any questions?
Yeah, no, that sounds great.
Okay. So just a few more things. So here is the consent form that I wanted to go over with you. And just like any other like profession or any other kind of medical care you're going to receive, like chiropractic has a lot of benefits, but it also has some risks too. And some of them being fracture, spinal or sprains and strains, and even stroke. But these conditions are very rare, and the fractures often happen from underlying bone pathologies. But we've fully examined you. We took all your x-rays, and you look really healthy. And then for the stroke, that is like 1 out of a million to 5 out of a million chance that will happen. And studies have shown that even though it's associated, so it's not actually correlated. So chiropractic adjustments aren't causative to this. These people have been proven to already have been having signs of stroke, and then after they get the adjustment, they fully get a stroke. So, but it was already like they were already getting to that point. So I don't want you to be worried. That's a very rare occurrence, like risk that will happen. But I just wanted you to be aware that is a risk. So some additional treatment plans or treatment things that you could do is you could go to your medical care doctor. They'll probably prescribe you prescription medication, which, as you know, it doesn't actually fix the problem. It just kind of like numbs the symptoms. But like what I want to do with you is I want to go to the cause of the problem, and I want to fix it. So then you aren't going to be having reoccurring headaches, because the overall goal is to have you feeling good, and not having to deal with like neck pains and headaches, especially when you have your life to live. So that's the goal for us. And do you have any questions about that? Okay, well, if you want to take your time and read this over, and then if you have any questions, you can always ask me, and you can sign it and bring it back. And so I think that's it. No other questions?
No, sounds good.
All right. Okay, so we'll plan to schedule an appointment next week, and we'll get started ASAP. Get your nervous system working to its fullest function. So I'm excited. Thank you.
Thanks.
Mm-hmm.